Like everybody that does orthopedics in general, a lot of us are sports athletes, and so a lot of us have our little war stories about, when I was in high school, when I was in college, I had X, Y, and Z happen. And it's easy to see a patient, hear a story, look at an MRI and say, this is what you need, but really you have to understand where they're coming from. And having experiences in sports yourself, you can kind of relate to what they're going through, both physically and mentally, and trying to decide what's the best outcome for them, what's the best option for them. I like to think about a patient as a whole. I like to think of them of where they are now, where they'd like to get to, and try to get them there with the easiest way possible. A lot of times that doesn't mean going straight from the office to a surgery. A lot of times it means there's a lot of little steps in between before we actually have to do that. And actually a big part of sports medicine is treating all the problems, whether they need surgery or whether they don't. One of the biggest reasons why I love working here is the team that we have. We've developed experts in all of our fields of orthopedics. You can just run a case by them or run a patient by them. They'll see them, or you can just kind of use their information to help you. It's different than any other place because the collegiality between us is so great that I feel like they're just an extension of me and I'm an extension of them. And I think that's a really special gift that we have. I think allowing people to continue on what they really love doing kind of makes me happy. Even seeing my neighbors walking around the block after something that we help them with, or it's nice to allow patients to be able to get back to their activities and feel like they're themselves again. We take for granted what we do on a daily basis, and our bodies are amazing, but they're not perfect. So trying to get them as close to perfect as possible, I think, is fun for me.